also thinking about you talking about the hormonal shifts in puberty, and also I hear a lot of women who are really having a loud inner critic during menopause, or if they have other hormonal dysregulations, such as like PCOS or other aspects of that. Can you discuss more on those medical conditions that impact someone's weight?
Absolutely. So, I mean, PCOS is a huge one. I see a lot of patients with PCOS, and PCOS is truly a disorder where there is insulin resistance, and there is sometimes weight gain as a result of insulin resistance that is from that metabolic dysfunction. And it can be so tricky because you want to address the metabolic dysfunction, but you don't want to focus so much on like your weight is a problem. It's more that your body is maybe not processing your sugar levels well, and so you are gaining weight as a result of that. That's a symptom. That's not the problem. That's a symptom of the problem. And how can we address that to manage that symptom for you, along with the other symptoms that come with PCOS? And there's so much body image issue with PCOS. Not all people with PCOS are in larger bodies or gain a lot of weight, but there can be excessive hair growth. There can be acne. So there's so much body image stuff that goes along with that. And so it's a huge contributor to developing eating disorder. And then certainly in menopause, the normal process of body change in menopause is we do store more fat around the midsection in particular, because of the gradual loss of muscle mass and the hormonal shifts that happen in menopause. And that is always looked upon as a problem, or this is you're getting sicker as you age. This is a problem you need to fix, rather than this is a normal process that happens with aging. And yes, it does increase the risk of metabolic disease, but also we know that when you are older, having more body fat is protective against frailty and against death from infectious disease, which for many people now, but certainly for our ancestors, was the biggest cause of death. So it's
Mm-hmm.
actually a protective mechanism that your body has in place. And then not just frailty from infection, but also for your bone mass.
Mm-hmm.
Having that extra estrogen stored in some fat is protective for your bones. And so you have to look at the big picture. But I think because societally we are so focused on weight, doctors also are very focused on weight. And, we have a lot of metabolic associated chronic disease nowadays because we live long enough and we have a lifestyle that is conducive to that in the modern world. But it's not always a problem. Some of these things that are happening are normal human things, and it's a balance of addressing our lifestyle in the best that we can without outsized focus on the weight gain.